Thank you all for listening in today. My name is Matt Farley. I'm a student physical therapist assistant, and now I'll be presenting an article review titled Goal-Directed Functional Therapy, a longitudinal study on gross motor function in children with cerebral palsy. So first, a little background on both cerebral palsy and the aims of the study that were done. So cerebral palsy is a disorder affecting movement. It can cause difficulties with thinking, learning, feeling, communication, and behavior. The presentation of cerebral palsy is very widely varied. Some of the more common symptoms that can be seen with cerebral palsy are difficulty speaking or eating, stiff muscles, uncontrolled movements, and an overall lack of coordination. So this study was done to basically investigate gross motor function and goal attainment in children with cerebral palsy before, during, and after goal-directed physical therapy. Goal-directed physical therapy is basically focus on therapy that's directed towards learning new skills in the context of daily life. These specific skills, they can be best expressed by the child and the family through the formulation of goals. These goals would then challenge the child's learning potential as they attempt to accomplish them. So let's look at some of the tools that were used during the study. First of all, the children were grouped based off of the gross motor function classification system. The gross motor function classification system is based off of 5 levels. Level 1, walks without limitation. Level 2, walks with limitations. Level 3, walks with adaptive equipment assistance. Level 4, self-mobility with use of powered mobility assistance. And level 5, cannot sit or stand independently. Primary outcome measure was the gross motor function measure 66. This is the widely used and accepted measurement tool that is done for those with cerebral palsy. It's based off of 66 questions. For example, one might say walks forward 10 steps. The therapist will then evaluate the patient's ability to walk forward 10 steps. If the patient is unable to initiate the task at all, they would receive a 0. If they can initiate the task but completes less than 10% of it, they would receive a 1. If they partially completed the task, they would receive a 2. And if they completely 100% could complete the task, in this case walking 10 steps, they would receive a 3 for the gross motor function measure. Goal attainment scaling. This was used to evaluate the child's ability to accomplish their goals. It's also based off a scoring system. A -2 is much less than expected. A -1 score would be less than expected. 0 would be an expected outcome. +1 would be a more than expected outcome. And +2 would be a much more than expected outcome based off of their goal attainment. Alright, so let's take a look at the study now. 11 boys and 11 girls of preschool age with varying presentations of cerebral palsy were selected. At the bottom there I made a chart that demonstrates exactly how they were selected. There were 3 children selected with unilateral left cerebral palsy, 5 with unilateral right, and 14 with bilateral cerebral palsy. 7 children were selected from GMFC level 1, 9 were selected from level 2, 5 were selected from level 3, and 1 child was selected from level 4. 5 goals were assigned to each child, making up a total of 110 goals. Before any goals were attempted to be accomplished, a GM-FM 66 was performed 3 times, and then once during the intervention, and 3 times after the intervention. Special needs teachers, speech pathologists, occupational therapists, and physical therapists all participated in this study. And the study was done in an everyday environment, once a week in groups, and it had a strong focus on play. The focus was on play, but it was all about achieving these goals that were selected. Alright, so let's take a look at some of the results of the study here. At the last follow-up, goal attainment to the expected level or higher was achieved in 103 out of 110 total goals. The chart on the bottom right there demonstrates this trend. After the first evaluation, you can see that out of 110 total goals, every single one of them received a -2 rating, demonstrated by that white line. Now moving forward towards the second, third, fourth, and fifth evaluation, that -2 rating completely disappears as more and more children continue to meet their goals, and not only meet them, but in often cases far exceed the expected outcome of the goals. You can see after the fifth evaluation, about 50 of the total goals received a +2, which is the absolute highest rating on the goal attainment scale. Most children also demonstrated an increased percentile after the intervention, irrespective of their GM-FCS level. This is demonstrated in the chart on the bottom left there. Each line represents the children from each different gross motor function classification level. You can see regardless of what level they're in, though, the trend shows that the children generally show great improvement in gross motor function. So the overall results of this study show that goal-directed physical therapy can be very positive. It can help children not only improve their gross motor function, but also achieve goals. So let's talk about some of the strengths and limitations of this study. Some of the limitations: there's a small number of children from the GM-FCS level 3 and 4, and there were no children from level 5. Most of the children that were in this study came from levels 1 and 2. Level 1 walks without limitation, level 2 walks with limitations. However, it would have been good to see more children from 3 and 4. Again, 3 was walks with adaptive equipment, and 4 was self-mobility with use of power and mobility assistance. It would have been good to see how goal-directed therapy responded for more children in those levels. There's also no information provided regarding kids receiving activity-based treatment. This entire study was done doing goal-directed therapy. It would have been good to see the results of goal-directed therapy compared to activity-based therapy to see how big the differences would be between them. There was a small pool of participants, only 22 children. It would have been good to see a larger pool just so you can draw a stronger conclusion. However, I think the overall study was pretty strong. Some of the strengths include not only physical therapists, but also occupational therapists, speech pathologists. The parents were also incorporating the treatment. I think that was very good. The tools of measurement are strong and widely accepted. So overall, I would say it was a pretty strong study, and it showed some pretty promising conclusions regarding goal-directed therapy in the treatment of cerebral palsy. So now, how can this study be useful to us as clinicians in the field? One thing that I really got out of this study was the importance of goal-directed therapy in the clinic. It might not be enough to always motivate somebody by saying, do these hip flexion exercises and this will make your hip flexors stronger. It might be better to motivate somebody by saying, let's practice walking up these steps so that you'll be able to walk into your house soon. That's a good example of goal-directed therapy. Someone can actually see that, they can envision that, and they can see how practicing walking on these steps will help them get into the house. It's a good, useful tool for motivation. I think this study did a very good job of motivating children overall. It can be very difficult to motivate children to do just about anything that they don't want to do, anything that they perceive as work. So what the study did was they incorporated play into their treatment. They found ways to engage the children by using toys, by having them play with other children, interacting with other children in everyday, regular environments. And they did a really good job of motivating these children and getting them engaged in their own treatment. Another thing I got out of this was the importance of proper documentation and measurements. It's important that when doing therapy, everything's documented properly and all measurements are performed and recorded using accepted and widely known measurements, so that other therapists can then come after you and continue treatment and know exactly what was going on, how you came to the results you did, how you did your measurements, and basically be able to understand what was done during your treatment so that they can then take the patient and continue the treatment in a successful manner. And here's the full reference for my article, Goal-Directed Functional Therapy, a longitudinal study on gross motor function in children with cerebral palsy. And I thank you all for listening.